Costa Rica is a major tourist destination, with its tourism economy constantly growing. Costa Rica is known as one of the happiest countries in the world, with its famous saying, Pura Vida, meaning pure life, but ultimately emphasizing a relaxed lifestyle of living in the moment. Costa Rica is one of the most biodiverse countries in the world. During the fall semester of my senior year, I had the opportunity to study abroad in Costa Rica. On the weekends, I traveled to beautiful places around the country. During the week, I studied at Universidad Veritas, one of the most well-known art, design, and architecture schools in Costa Rica. During the 3 months I spent in Costa Rica, I studied the situation of poverty in Costa Rica and took photographs to convey what I saw. It became evident that Costa Rica, despite all its natural beauty and resources, has a significant population living in poverty that often goes unnoticed. The poverty rate in Costa Rica has stayed consistent for the past 20 years. Costa Rica currently has a poverty rate of 21.7% as of 2015. 1 in 4 children live below the poverty line. 21.3% of the population live in poor households, and 6% of those households are in extreme poverty. The region of San Jose has the lowest poverty rate of 17.2%. The Southwest Brucan region has the highest rate of poverty of 36.2%. Costa Rica is one of only 3 Latin America countries where income inequality has risen a significant amount. The indigenous people are suffering greatly from poverty, with Costa Rica not being efficient in protecting the cultural, political, and social-economic rights of these people. Nicaraguan immigrants who have been here for years also suffer greatly from poverty. In 2004, the poverty rate for Nicaraguan families in Costa Rica was 30.6% compared to 21.7% for Costa Rican families. These people living in poverty often end up selling drugs for a source of income. Informal businesses are also another common way to make money. These informal businesses consist of little huts selling fruits, vegetables, clothes, or other goods. Prostitution is also another common way for people to make money. I had the opportunity to interview several organizations that are helping those living in poverty. The first organization I interviewed was the Costa Rican Humanitarian Foundation. This organization manages more than 50 volunteer projects throughout the country, focusing on education, community development, primary and preventive health care, and extensive support services for women, at-risk youth, and indigenous groups. I had the privilege of interviewing Gail Nystrom, the founder of the Costa Rican Humanitarian Foundation. Okay, so you have the daycare center, then do you have...
So I have, in this community, I have 3.
Okay.
I have a community center, community drop-in tutoring center.
Okay.
Down by the river down below. I have the Model Education Center, which is where we have 4-year-olds going to school, or to our program, to get ready to go to public school. Like, in the top-notch, most confident, sure of themselves. They're the top students in the kindergarten, in the public school.
Oh, wow.
And then when they get old enough, they immediately put them into first grade.
Yeah.
So that, and then we have a program where the grandmothers of the community run a little thrift shop and a public library.
Oh, wow.
And then we have this one, which is from 6 in the morning till 6 at night, daycare, care for the children. Yeah, we have over 1,000 volunteers a year, and they work at all those levels that I mentioned before, like making sure people have food, water, housing, etc., etc., etc. And then the ultimate thing is, what we're getting with the people here now is a lot of artwork and creativity, because they're not worried about, are they going to eat every day? So they can do some interesting things with their art ability, with their creativity.
Yeah.
And also their relationships with their kids are much better, and their confidence as parents is better, because they're not worried all the time, like, do I buy rice or do I buy shampoo? And my kid has lice, so I really need the shampoo, but I also really need to feed them. That's how poverty forces you to make decisions.
I also had the opportunity to visit Parque Libertida and interview Carol Goodfellow, who works as an art teacher for the organization. Parque Libertida seeks to promote social change, economic, and environmental development with the help of communities.
This park is just helping people, like teenagers and young people who drop out of school because they couldn't support their family and they had to go and work outside to be able to do that, or because they fall into drugs, or because they just don't see any point in continuing studying, so they just drop out. So the park gives them an opportunity to go back to school, to teach them some kind of skill that will help them make money in a certain way, or even to give them a space to do what they want to do, but in a safe environment. For example, Skatos is like the group of people who skate, and normally they are frowned upon because they are seen as people who doesn't do anything, just stay in the corner in the streets and do bad things because they are dropouts do drugs. And the park gives them a space to make that exercise, that sport, and actually get something out of it. The people who make graffiti, the park gives them a space to do that.
The next organization I visited was TECO. TECO works in slums to overcome poverty through training and joint action of its people and young volunteers, along with promoting community development.
Our priority is the development of community, the community development. How can you say out, like when they do it, when they do it their own way.
So you're saying
We're trying to empower the people. We're trying to educate children. We're trying to make possibilities for entrepreneurial like ideas from that population, so they can be responsible for their own development. So we have a lot of programs, a lot of projects that are like going to that specific objective, with that constructing a home for that family, which they pay a percentage of that home and we finance the other part. So that's the first step. Then we address the situation by a lot of other programs and projects, education, financial solutions for parents so they can make their own businesses.
The last organization I interviewed was the Foundation for International Medical Relief of Children. This organization focuses on clinical activities, health education, and special initiatives for those of lower income. I had the privilege of interviewing Tatiana Blanco, the operation manager in Costa Rica for the organization.
I work here in FIMREC. FIMREC is an international organization. Costa Rica is the first project that they built. We have like almost 10 years being here in the community, and they have like 8 clinics around the world in different countries. The idea is provide medical service and medicine to people that cannot afford this, or they have not access to this condition. So this clinic will stay in the main of the city. The hospital is like from 5 or 10 minutes from here. But the people that we treat doesn't have access to medical service because they are not having like insurance. We have a really good health system compared to other countries in Central America. Like the medical basic conditions are covered by the health system. The people that we have here, they doesn't have access to the social security because they are not they are working here in illegal conditions. I think that they are here working and they are doing a really good job, especially if they do all the jobs that the Costa Rican doesn't want to take. I think here is that we give like medical service, we give medication, and we give psychological service to the people that doesn't have access. We have part of our work is a health education program. So in the time when we started like working here, we are like just like firefighters. We're just like resolving the situation for the day and like the emergency that they have. But in 9 years with the program of health education, we are like having a lot of prevention right now. They are taking better control of their health. They are having a service here that they come regularly. They give like lectures about nutrition, about like healthcare or things like that. That really helps them.